everyone, this is Carla Solorzano RN, and today I will be presenting about the creative project and about the product that I created for this class. I'm going to start off with introducing my product. My product consists of a painting on a 5x7 white cotton canvas. I used water paint for this painting, and my colors of choice were brown, black, green, white, yellow, and turquoise. This painting consists of a vase shaped as an upper body or shoulders. It consists of daisy flowers and a half moon shaped necklace. I decided to name this painting Foundation. As you guys can see, this is foundation, and as I mentioned earlier, foundation consists of the brown vase, and the vase is actually shaped as an upper body or shoulders, as you guys can see. Then we have the black half moon necklace, which is a little personal touch, and we have the daisy flowers that consist of the green stems, the white petals, and the yellow discs. Now I will be talking about the base. The base basically holds water and provides support to the stem and the entire flower in general. This represents compassion, devotion, and empathy. Therefore, this resembles the professional role of a nurse. As professional nurses, we are devoted to our patients, and our mission is to provide the highest quality of patient care and promoting empathy and respecting every single one of our patients. Moving on, the stems. The stems provide nutrients and hydration to the petals and the discs, keeping the flower alive. This represents support, loyalty, and growth. This resembles advocacy. As professional nurses, we are ethically responsible for advocating for our patients. This means that we have to protect our patients' rights, and by protecting our patients' rights, we are also improving patient care. And not only improving patient care, we are also standing up and speaking up for those that are vulnerable. For example, patients that are unable to communicate their needs or their concerns. We are there as professional nurses to speak to physicians, speak to the entire interdisciplinary team, and advocate for our patients' care. And this is a responsibility as professional nurses. Now I will be talking about the petals. The white petals represent harmony, empowering, and nurturing. This resembles servant leaders. As nurses, we are all servant leaders, and we are servant leaders because we prioritize our patient needs. We genuinely care about our patients' well-being, and it's not just physical, it's also psychological and psychosocial. We are constantly demonstrating empathy by providing the highest quality of patient care and demonstrating compassion during our care. And we are also constantly, throughout our shift, collaborating with an entire interdisciplinary team, such as OT, PT, physicians, family members, and the patient. And this promotes a healing and nurturing environment and promotes positive patient outcomes. As servant leaders, we are constantly helping, collaborating, and promoting positivity and enhancing patient satisfaction. Lastly, I will be talking about the discs. The yellow disc represents wholeness, unity, eternity, and inclusivity. This resembles communication. As professional nurses, we are required to effectively communicate. This is a skill, and it's a skill that perhaps a lot of nurses already have before they become nurses, or it's a skill that nurses acquire throughout their experience. We are required to effectively communicate because we need to effectively convey information, especially during report. We are also responsible for advocating for our patients, and if we can't properly communicate, how can we possibly advocate for our patient needs? We are also constantly collaborating with an entire interdisciplinary team, and this requires for us to be communicating with PT, OT, physicians, We are also constantly educating our patient and their family member, because most of the time the patient and their family members do not understand medical terminology. And by educating them in a way or a form that they can understand, we are promoting high quality of patient care, we are promoting patient satisfaction, and we are also promoting positive outcomes. And this will create and nurture an environment for a patient to actively try to complete milestones so they can potentially go home as soon as possible. Hi everyone, this is Carla again. Thanks for watching part 1 of my creative project presentation. This is going to be part 2, and it's going to be basically an update about my creative project. When I first created my painting, which is Foundation, I focused on compassion and caring for my patients. Throughout the BSN program, my view of nursing has grown so much, and I have a complete different perspective. I now see that nursing is more than bedside care. Nursing is about leadership, education, and advocacy. A professional nurse is not just a caregiver, but also a mentor and educator who guides others. I'm going to talk about the core values of Foundation now. The parts of my painting have a deeper meaning now. The stems, which represent advocacy, remind me that it's not just about speaking up, it's also teaching and empowering patients to make their own decisions. The petals, which stand for servant leadership, remind me that true leadership is shown through kindness and leading by example. And the disc, which symbolizes communication, is even more important now, and I learned this working in an emergency department. Clear and respectful teamwork keeps a patient safe. Lastly, we'll be moving forward. This program has inspired me to keep growing as a nurse and to advocate for patients who can't speak for themselves, which I often encounter in the emergency department. My long-term goal is to move into advanced practice, possibly become a CRNA, or I am also considering emergency nurse practitioner. And my main goal overall, regardless of which route I decide to go, is to continue making a difference in my patients' lives. I want to thank you guys for watching my presentation. This BSN program has really, truly helped me grow as a nurse and strengthen my meaning behind my creative project. I'm grateful for the knowledge, experiences, and encouragement that have shaped me into a better advocate, leader, and communicator. I look forward to carrying these lessons into my practice and continuing to grow in this profession. Thank you.